Hello, good morning, students. Hoping all of you are fine. With respect to the last class, the answer that most of you, all of you, got right was quinine. Okay, so the anti-malarial drug, which is which was origin from the nature, which was being derived from the plant or a tree. It is quinine. So anti-malarial drug is quinine. Okay, so you have got your answers right. In the last class, we studied about the principles of treatment. Today, we are going to start with principles of prevention. I have taken a small note from the textbook directly, okay, because there are 3 points that are to be covered. So, initially, I would be going with a reading part, a little bit of reading part that you people need to focus in your textbook. And I normally say that you have to follow your NCERT, so don't skip reading your textbook. It doesn't matter whether you are using any particular resources, you are going online for your studies, but make sure that your concepts are sticking to the NCERT textbook itself. Okay, so that's where the basic of the questions will be also coming from. So reading part now, principles of prevention. All of what we have talked about so far deals with how to get rid of an infection in someone who has the disease. But there are 3 limitations of this approach to dealing with the infectious disease. Okay, there are 3 limitations. Those 3 limitations I have highlighted, and we will be having an initial discussion on these 3 points that are there. So, what's the first one? Okay, well, what's the first approach that is there? The first is that once someone has a disease, their body functions are damaged and may never recover completely. First instance, example with respect to heart attack, myocardial infraction. So in that you are seeing that the cardiac muscles that are there of an individual, they get damaged. So the chances of recovery is relatively very less. In the same manner, if somebody is observing renal failure, that is kidney failure, so the same instance will be there. The first is that once someone has a disease, their body functions are damaged and may never recover completely. So 2 things I have explained over there. Second one, the second is that treatment will take time, which means that someone suffering from a disease is likely to be bedridden for some time, even if we can give proper treatment. Like for example, the disease of tuberculosis. Okay, so tuberculosis disease, we have certain sets of medicines that are there. It's called as the DOTS dose, that is particularly there, where the individuals are being given with a combination of drugs that will be killing the bacteria. So the treatment is possible, it is a short treatment itself, but it will be taking a relatively long period of time. Okay, so that's what is being stated over here. The second is that treatment will take time, which means that someone suffering from a disease is likely to be bedridden. Okay, so the TB patients are likely to be bedridden for some time, even if we can give them the proper treatment, while the third one, okay, third is the most important one, what we are practicing now on our daily basis. The third is that the person suffering from an infectious disease can serve as a source from where the infection may spread to other people. Coronavirus, when somebody is positive, what is being done? We quarantine them. Okay, we isolate them. Thus, what is being happening? Thus, you are preventing the source from the further infection. This leads to the multiplication of the above difficulties. It is because of such reasons the prevention of disease is better than their cure. Okay, so initially when the coronavirus was just taking a step in different countries, we know initially we also started very nicely, like 21 days of lockdown, extended again, but meanwhile when the lockdowns were a little bit relaxed, the spread of the disease took place very drastically, and that's how we are now having increased number of death rate also, not death rate actually, increased number of death as well as increased number of infectious patients. So what are we doing over there? We are identifying finding the source here and we are quarantining them so that the spread of the disease can be there in a controlled manner. So these are the three main approaches: the first approach, second and the third approach. So just stick to reading the NCERT, you would be coming to know much better. Now, how can we prevent a disease? Earlier we saw how the disease can be treated. So remember I told you that first we will be taking a small first aid, then we will be going to the doctor, then the lab test, then killing the microbe. Like that, the step by step has been done to treat a particular disease. But suppose if we want our body to be prevented from the attack of these microbes, what we have to do? We have to take proper preventions. What do we have to do? We have to take proper preventions, because prevention is always better than cure. Prevention is always better than cure. So there are two general approaches. Two approaches are there by which the prevention can be done. So what are they? So first one is called as your general way of prevention, while the second one is called as the specific way of prevention. There are two methods. I would be taking only the general way of prevention today. The specific way I would be explaining in the next class, because otherwise it would be a little bit lengthy. So I'm just taking the half portion today. Half portion I'll be taking up in the next class. So what am I discussing today? I'm discussing today about the general ways of prevention. Okay, so starting with again, what are we practicing right now? Mask, sanitizing and social distancing. These are what we are practicing right now. Why? Because there can be an infectious person, so we are preventing ourselves, we are protecting ourselves from the infection of the virus. So this is what method? This is the general way of prevention. What is it? It's the general way of prevention. Principles of prevention. There are two ways of prevention of infectious diseases. They are the general way and the specific way. The general way. In the general way, we are practicing hygiene. We are practicing hygiene. We are practicing social distancing, as well as we are practicing the wearing of mask. Okay, so public hygiene is most important for prevention of infectious disease. Public hygiene, where comes our Swachh Bharat Abhiyan. You have to relate all these points. Whatever is going in your surrounding, you have to come to know, and then only you can give a good presentable answer. Okay, so public hygiene is most important for prevention of infectious diseases. When we use proper toilets, so the fecal matter is not getting mixed with the water, proper sanitization is there, and thus we are safe. We are safe because our drinking water is not getting contaminated, so we don't have the fear of cholera, we don't have the fear of typhoid or any other waterborne diseases. Second one, proper and sufficient food for everyone will make people healthy to resist the infection. Apart from practicing social distancing and everything, now whenever coronavirus everything was being discussed, drinking hot water, vitamin B, vitamin C, vitamin D, multivitamin tablets, all this is being suggested by the doctors, and this is the normal prescription also that they would be giving to a patient who has been corona positive. Okay, why? Because when we have these supplements, your body gets energy, your body gets nutrients, your body's immune system start working, your body's immune system improves. During the winter time, it's a normal practice there in North India that Chyawanprash, okay, children or the old age people that are there, they are given 2 spoons of Chyawanprash, or they are being given desi ghee. They will be given ghee, that is nehi, clarified butter. Okay, they would be given that. Why? Because it is providing them energy, it is providing them different types of supplements that is needed for your immune system. It is needed for your immune system to fight all the different types of bacteria and germs that are entering your body. Okay, you might have seen the different advertisements also, like recent one, Lifebuoy. I'm not actually giving it a comment. Lifebuoy one having a silver shield protecting against the bacteria and everything. It's actually our immune system that is protecting. So we need to have good nutritious food. If we don't have good nutritious food, you end up with certain diseases like scurvy, beriberi, rickets. These are all deficiency diseases. Kwashiorkor, marasmus, all these are different types of deficiency diseases that are there. Next one is airborne diseases can be prevented by living in conditions that are not crowded, that are not crowded. One common scenario that would be there, observed in our school or at our home: you open a room which has been locked for many months or weeks. When you enter the room, you suddenly start sneezing. Why? Because dust is there. In the same manner, if you are there in a crowded area, if one person sneezes, there are chances that there would be another person who starts sneezing, and the cascade may go on, because it is what it is, the particles are passing through the air. So airborne diseases can be prevented by living in conditions that are not crowded. Waterborne diseases can be prevented by providing safe drinking water. This you have studied in your 8th standard. Potable water, safe drinking water is called as potable water. So you have different methods, like you have filtration, sedimentation, boiling, adding chlorine tablets. All these are the different methods that are there. And finally, vector borne diseases can be prevented by providing clean environment. Okay, so these are the general ways of prevention. I stated I would be only taking up this I am going to explain in the next class. Okay, so this is about the 5 tips to prevent the spread of airborne infectious diseases during the time of monsoon. It's not only during the time of monsoon, you can practice this on a daily basis. So cover your nose and mouth with a tissue while sneezing and coughing. Oh my god, when we actually take our phone to call somebody, you can see that the corona auntie would be giving you a long message. In that, this is the first statement that is being said by corona auntie. Okay, so you have the sanitized surface and wash your hands often. It's actually good that government is taking steps to make people aware. We just told it in a silly manner, but no, it's actually really very important. Okay, get plenty of sleep and drink lot of liquids. Do not share glasses, spoons, forks and tissue. Avoid visiting ill friends and relatives. This is what you can practice. Next one, disease caused by water pollution. So you are having diarrhea, vomiting, typhoid, diphtheria, hepatitis, kidney damage, nerve disorders and skin lesions. So how can you prevent water pollution? So you have different methods like sedimentation, filtration, disinfection. This was being explained earlier. This is just picture representation that I am going. Now vectors. Okay, you have wild animals, you have pets, or if you are having livestock, there would be some animals which will be found on their body, and they are responsible for giving us a particular disease. So humans, they can transfer the disease to humans or to another animals. Like vectors can carry diseases that can affect both animals and humans. Such diseases are called vector borne diseases. They are called as vector borne diseases. Mostly when we talk about vectors, the two important vectors that comes into our mind, first one is mosquito, while second one is the housefly. If you are having pets at your home, you'll be seeing that the ticks are very common on their body. Cow's body, dog's body, you can see that the ticks are there. So you have your anti-tick shampoos are there, anti-tick powders are there. Okay, so such type of treatments are given by which the ticks can be completely removed. Otherwise they can come and attack us. They can come and sit on our body and start feeding from our body also. So we must be taking care that we are able to manage the vectors. This is very common. I hope you might have understood. Tire, stagnant water, mosquito will come, it will be the breeding place, there will be formation of the larvae and it gets completely converted into an adult mosquito. Metamorphosis, the process is called as metamorphosis. So we must be practicing such healthy methods by which there is no stagnant water in our surroundings. So this must be removed, or you can spray kerosene, you can spray liquid soaps and detergents, so that the breeding ability, the egg laying, or what we can say, the hatching ability of the eggs is lost, and the formation, metamorphosis won't be taking place. So the breeding can be prevented. Next one, old times, like since in the year of 2000, 1999 2000, when you people were there in the school, it's since around about more than 6 months that we are there at our home. You know, when you sit close to your friend who is having cough, cold and fever, you automatically have a tendency sometime, or there are chances that you may also get cough, cold and fever. Okay, there are chances, 50-50 chances. Sometimes you may get, sometimes you may not get. When will you get it? When your immune system is weak. When your immune system is weak. When will you not get the infection? When your immune system is strong. So you have your immune system that is playing a major role which will be preventing from different type of diseases. Okay, so which system? It is the immune system. And when you have a look at your immune system, where is the system actually present? It is there in our blood. Okay, it's there in our blood. So in our blood we are having these many numbers of cells. We are having these many numbers of cells. Okay, നമ്മൾ already cells in a chapter നിങ്ങൾ പഠിച്ചിട്ടുണ്ട്, and in that you have studied about blood, granulocytes, granulocytes different types, agranulocytes different types. So you are having neutrophils, eosinophils, basophils. You are having lymphocytes classified into large lymphocytes, small lymphocytes. Then you are having monocytes. Okay, this is the extended version of it. This is the extended version of it, which is saying that in our blood we have number of cells. We have number of cells, and the WBC cells especially, they are having the function of fighting with the invaders. They are having the function with fighting with the invaders. So you have a lot of cells that are working day and night to protect ourselves, to protect the body. Okay, so if your immune system goes down, what will happen? We get a disease. Immune system goes down, we get a disease. Immune system is good, we are resistant to particular disease. In the case of AIDS, what is it? AIDS is acquired immunodeficiency syndrome. AIDS is acquired immunodeficiency syndrome. So what is this HIV doing? HIV is the virus. What is this HIV doing? HIV is going and attacking the immune system. HIV is going and attacking the immune system. So what will happen? All these cells that are there, which are protecting us from various different types of infections, they are knocked down. They are knocked down, and thus what will happen? The person who is being infected by HIV, they would be getting many different types of infection. They would be coming in contact with many different types of infection, and thus will have a lot of disease. Will have lot of disease. Okay, so name the system that is protecting us from the different types of invaders. So it is the immune system. And where is this immune system actually found? Where is this immune system found? So immune system is found in our blood. In our blood we have n number of WBC cells which protect us from different types of attack of the microbes or pathogens or the agents that are there. So this is about the immune system. You can take a moment to pause the video and just read the names. That would be fine. Okay, I don't think that would be much clear. I saw this picture was actually a little bit more popping out, that's why I took this picture. So just take the time to read the names that are there. And finally, you need to have good nutritious food. So a balanced diet is needed, which will be containing milk, fruits, vegetables, that is veg and non-veg. Classifying, just narrow it, veg and non-veg, in which you must be having fruits, vegetables, milk, eggs, meat, mushroom, broccoli, carrot. I can see many things that have been there. Okay, now what's the activity that you have to do today? Your task, your comment section that you have to do today. You have to write your name, your class, as well as you have to mention your favorite nutritious food and the nutrient that is present in it. Okay, what do you have to do? You have to write your name and you have to write your favorite nutritious food or the item or the fruit or vegetable, whatever it is, and the nutrient that it is containing. Okay, so that's the task is been assigned. That's the comment section. I handle 4 divisions. I can see hardly the comments are coming around about 80 to 90. Why are the other students remaining dormant? Why are you sitting idle? Why are you remaining in a hibernated state? I am taking the class. I want everybody to comment. Okay, otherwise I will now make a report to give a absent to you people. Mark and leave to you people if you are not giving a comment in my class, in my biology class. Okay, so make sure that you read the textbook. I've just taken the portion about the activity. Okay, or I don't remember the number of the activity. So about the activity, just the general ways I have taken, specific I would be taking up in the next class. And don't forget to comment with the question that I asked you. Okay, so take time to pause the video and just read the names of the different types of cells. Okay, that's all for today's class. See you in the next class. Thank you all.